All right, so residency reflection. I don't even know what week it is anymore. Um, but this past week, I started in inpatient rehab at MedStar National Rehab Hospital, and totally, totally different than acute care. Much slower pace, just kind of throughout the day. Much more of a relaxed environment. Um, I'm primarily on the unit for people with spinal cord injury. So I'll be seeing a lot of patients with spinal cord injury or disorders. And then I might be seeing a few patients post stroke or with traumatic brain injury because they're really strict about cohorting floors. And if they have overflow beds, they're not going to be rotating floors just because of COVID restrictions and things like that. So it'll be nice. We're there every day, Monday, Wednesday, Friday. It's like a 4 hour workday, and then time in the other part of the day to work on a research project that we're starting and things like that. And then Tuesday, Thursday is a 6 hour day with 2 hours being the mentor days. And yeah, it was nice. It was just a quick orientation. Got to observe for a few patients. Got to lead for a few patients, and then kind of started developing my own caseload. Um, and I did an eval last week and just kind of getting the flow of their system down, kind of figuring out the different documentation. It's the same documentation system, but it's a different process that you have to go through, and there's a couple extra things that you have to do just to familiarize myself with their processes and systems, and then some of those extra things I mentioned earlier, just like little things for insurance purposes and things like that. Nothing too crazy. So yeah, it was nice. I think I'm gonna miss like the constant chaos of acute care because I kind of like that, and I kind of like all of the constant problem solving. But I think it's going to be a better learning environment with a little bit more time with the patients. Well, a lot more time with patients, and it's a much more scheduled and regimented facility than acute care is. So that's going to be kind of nice, just in terms of being a little bit less stressful. And I think it's just going to be a better learning opportunity maybe than acute care. Just because it is slower and there isn't such that constant chaos. But I do miss the constant chaos of acute care a little bit. And I'm going to try to do some PRN stuff on the weekends at the acute care hospital just because I want to keep kind of exploring that setting and developing some of my skills there. I'm in the process of kind of figuring out what I need to do to get that in order. But and then other than that, it's a great week, good orientation week, and got to put some hands on patients. And spent the weekend at a friend's in Maryland. Kind of got out of the city and into the woods a little bit, so that was nice. Just good for the soul. Good to hear the wind in the trees, and excited to keep going in inpatient rehab. I've had experience with this setting when I was on my final clinical in California, but I'm excited to get to really kind of learn and grow more independent and get more experience with it, because I think it's a setting I might want to work in after residency. And on that note, I also think I could see myself working in acute care because I had a lot of fun there. So that's this week's residency reflection. Stay tuned for more. Thanks for watching.